Welcome to the deep dive. You know, today we're tackling something that I think hits close to home for a lot of us. We're looking at how we can best help our aging loved ones, especially when it comes to things like managing anxiety and pain and insomnia. You guys sent in some really interesting research and articles on this, and it seems like doctors are kind of stuck between a rock and a hard place. You know, trying to balance giving their patients relief, but also being aware of the risks that can come with certain medications, especially some of the more common ones like benzodiazepines and opioids. So we're going to really break this whole thing down.
Yeah, it's a tough situation for sure. No easy answers. We're going to look into these specific medications and talk about why alternatives are often so hard to come by, particularly for older folks. And hopefully we can give our listeners some good strategies for navigating this whole thing.
Okay, so first things first, we got these three biggies: anxiety, pain, and insomnia. And the research you sent over, it really highlights how much these things are all connected, especially for older adults. It's like rarely just one thing, right?
Right. It's usually a bit of a cocktail. And that can really impact their quality of life. What's interesting is that a lot of times these issues are just brushed off as being just like a normal part of aging. But, they really shouldn't be. They can significantly impact a person's life. And if you ignore them, it can snowball into even bigger problems.
Yeah, and to make things even more complicated, there's this whole issue of polypharmacy. Basically, when seniors end up taking multiple medications, sometimes prescribed by different doctors, sounds like a recipe for a disaster waiting to happen.
Oh, absolutely. Polypharmacy, it increases the chances of, harmful drug interactions and all sorts of side effects. It's like spinning plates,
Yeah.
Eventually one of them's going to fall. And for older adults, because they tend to be more sensitive to medications to begin with, those consequences can be a lot more serious.
So it feels like a catch-22, right? Seniors need relief from these really tough symptoms, but then the solutions that we have come with their own set of risks.
Exactly. A really good example is benzodiazepines. They're pretty commonly used for anxiety, and while they can offer some temporary relief, there are some pretty serious risks that come along with them, especially for seniors. Their bodies process these drugs more slowly, which means they're more vulnerable to things like oversedation and falls and even cognitive impairment. And if they take them long term, the risk of dependence and addiction, it goes way up. That's a huge concern.
When I was reading through all these articles, I came across this quote from Dr. Ariel R. Green. He's like a leading expert in geriatric medicine. He says, prescribing medications is often seen by clinicians as like doing something for the patient, whereas stopping medications is often seen as giving up. And I thought that was really telling. It shows the kind of pressure doctors are under.
Oh, for sure. It's this complicated mix of factors. You've got societal expectations for like quick fixes and limited time for doctors to really have those in-depth discussions with their patients. And on top of that, there's often just a lack of readily available alternative treatments, especially when it comes to things like chronic pain.
So yeah, doctors are caught in a bind, wanting to help their patients feel better, but also having to consider the potential long-term harm.
A true dilemma. And it's made even trickier by the fact that these medications often come with a big price tag and can lead to things like, costly complications like falls and hospitalizations.
So how do doctors even begin to navigate all of this? I've heard of something called the Beers Criteria. Is that helpful at all?
The Beers Criteria is a really good guide. It was developed by the American Geriatric Society, and it's basically a list of medications that could be inappropriate for older adults. But it's not like set in stone. It's more like a starting point for conversations between doctors and patients and families.
So it's like a yellow flag, not a red light.
Yeah, exactly. It helps everyone make informed decisions about certain medications, weighing the risks and benefits, taking into account the senior's overall health and any other medications they might be taking.
So what about the meds we've been talking about, those benzodiazepines and opioids? Do they end up on this Beers list?
A lot of them do, actually, like amitriptyline, diphenhydramine, and meperidine. They're all commonly prescribed, but can be especially risky for seniors. And, it's not just about age. The Beers Criteria takes into account individual patient stuff, like how well their kidneys are working and any other health conditions they have.
Okay, so it's really personalized then.
It has to be, because every person is different. And what works for one person might not be right for another, especially when we're talking about older adults.
That makes sense. So this brings us to something else. I've heard of deprescribing.
Ah, yes.
What is that exactly?
Basically, it's the process of safely reducing or stopping medications that might not be necessary anymore, or, they might be causing more harm than good. It can be a big help for seniors who are dealing with taking a lot of different medications.
So kind of like hitting the reset button on their medications situation?
Yeah, you could say that, but it takes careful planning and a lot of open communication between the patient, their family, and their doctor, so it can be a bit of a process.
So deprescribing sounds like a good idea in theory, but I imagine it's not always so simple. Like convincing someone to stop taking a medication they feel is actually helping them.
You're totally right. It's definitely not always easy. There are a lot of roadblocks that come up for both patients and doctors.
Well, let's start with the patient's perspective then. What makes someone hesitant to stop taking their meds, even when there are risks involved?
I think a lot of it comes down to fear. Imagine you've been taking a medication for years and years, something that's helped manage your anxiety or deal with chronic pain. The idea of stopping even gradually can be really scary. You worry those symptoms are going to come back full force, maybe even worse than before.
Yeah, change is scary for anyone, especially when you're dealing with health issues and, just the uncertainties that come with aging.
For sure. And then you also have to consider the emotional attachment that people develop with their medications. They can represent like a sense of security, that something is being done to address their suffering. So letting go of that can be tough.
It's like a safety net in a way. So how can doctors help their patients, overcome those fears and make deprescribing a more comfortable experience?
The key is really building trust and having open communication. Doctors need to explain the reasoning behind deprescribing in a way that patients understand, highlighting the benefits of cutting back on medications and addressing any concerns head-on. And it's important to provide ongoing support and reassurance throughout the entire process.
So it sounds like deprescribing requires kind of a shift in the doctor-patient relationship, moving away from that quick fix mentality we talked about earlier.
Exactly. It's about working together as partners, where patients feel empowered to make decisions about their own health. But it's not all on the patients. Doctors face their own obstacles too when it comes to deprescribing.
Like what? What kind of obstacles?
Well, one of the biggest hurdles is just time. Doctors, particularly in primary care, they're dealing with crazy schedules. And often they simply don't have enough time to thoroughly review each patient's medications, research alternatives, and really engage in those in-depth conversations about deprescribing.
So it's not necessarily that doctors are resistant to the idea. It's more of a systemic problem then.
That's exactly right. It's the healthcare system itself. It's often not set up to support this type of personalized care. And then you've got patients seeing multiple specialists, which adds another layer of complexity.
Right. We talked about that earlier. It's like trying to solve a puzzle with pieces missing. So how can we improve the coordination between different providers?
That's a crucial question. We need better systems for sharing information between doctors and pharmacists and everyone involved in a patient's care so that everyone's on the same page about medications. Electronic health records can be helpful for this, but we still have a long way to go.
And to add to that, there's the fact that for a lot of medications, there just aren't clear guidelines for deprescribing.
That's true. Deprescribing is still a relatively new field and research is ongoing. But for many drugs, we're still figuring out how to best reduce or stop them safely and effectively. This lack of standardized protocols can make doctors hesitant to jump on board even when they see the potential benefits.
So they're kind of stuck between a rock and a hard place, wanting to do the best for their patients, but also needing more solid evidence to feel confident.
Right. Trying to balance the potential risks of keeping someone on a medication versus the potential risks of taking them off. And sometimes the unknowns can be pretty scary.
It all sounds a bit discouraging, to be honest. Are there any positive developments in the field that give you hope for the future of deprescribing?
Absolutely. There's a growing movement within the medical community to really prioritize deprescribing and to create better resources for both patients and doctors. The American Geriatric Society, for example, is doing a lot to promote education and research in this area.
And there are those incredible online resources we talked about earlier, like MedStopper and the Canadian Deprescribing Network. Those give patients and families the tools to be more involved in their medication management.
Those resources are game changers. And more healthcare systems are implementing electronic health records with features that can help prevent unnecessary refills and potentially flag medications for deprescribing.
So it sounds like things are moving in the right direction. That's good to hear. So amidst all this complexity, what's the bottom line? What should people listening take away from all of this?
The main takeaway is this. Deprescribing is not about taking away treatment options. It's about making sure seniors are getting the best possible care. It's recognizing that sometimes less is more, and reducing unnecessary medications can actually lead to a better quality of life.
So it's about empowering seniors to live their best lives without being weighed down by unnecessary pills.
Exactly. And it's an ongoing conversation that requires open communication, collaboration, and a willingness to question how things are currently done.
That makes a lot of sense. We've talked about the challenges and benefits of deprescribing, but how can our listeners actually put this knowledge to use? What steps can they take to advocate for their loved ones and make sure their voices are heard? So we've covered a lot of ground here talking about all the ins and outs of managing medications for seniors and the potential upsides of deprescribing. But now let's make this practical. At the end of the day, what can our listeners actually do with all this information?
Yeah, knowledge is only powerful if you can actually use it right. We want to give everyone some real tools and strategies they can use to advocate for their aging loved ones and help them navigate this whole complicated world of medications.
So let's get down to brass tacks. What are some concrete steps our listeners can take to ensure their loved ones are getting the absolute best care, especially when it comes to meds?
Well, we've already talked about the importance of a complete medication list. And, having open and honest conversations with those healthcare providers, those are your must-haves, your foundation.
Right, those are key. But what else can we do to be proactive advocates for our loved ones?
One really crucial strategy is to be present and involved during their medical appointments. Be there with them. This is especially important if your loved one has any cognitive issues or struggles to communicate their needs effectively.
So kind of like being their voice when they can't speak for themselves.
Exactly. Your presence can make a huge difference. You can help fill in any gaps in their medical history, clarify things if there are any misunderstandings, and really advocate for their preferences and goals.
And it's not just about speaking up, is it? It's also about being a good listener, paying attention to what the doctor is saying, asking questions, and making sure you really understand the why behind their decisions.
Absolutely. And don't be afraid to jot down notes or even record the conversation if the doctor is okay with it. This can be a lifesaver, especially when you're dealing with a bunch of different medications. It's like having a roadmap for their care.
That's a great tip. But what happens when you don't agree with what the doctor is recommending? Or if you're worried about a particular medication, how do you handle that kind of situation?
Well, it's important to remember that you're a vital part of the care team. You have every right to express your concerns and to fight for what's best for your loved one. If something doesn't feel right or you're having second thoughts about a certain treatment, don't be afraid to speak up.
But what if the doctor seems rushed or like they're brushing off your concerns? That can be kind of intimidating.
It can be, for sure. But again, you are your loved one's advocate. You have the right to ask for clarification, to express your concerns, and even to seek a second opinion if you feel it's necessary.
So it's about striking that balance between being respectful and being assertive.
You got it. And let's not forget about the emotional side of all this. Deprescribing in particular can be a pretty emotional process for seniors. They might be scared resistant or even feel like they're losing control.
So how can we offer them the best emotional support during that process?
Patience, empathy, and open communication, those are your superpowers. Let your loved one know that you hear them, that their feelings are valid, and that you're there for them every step of the way. Keep reminding them that deprescribing isn't about giving up on treatment. It's about finding what works best for them to really optimize their health and well-being.
It's about moving beyond just managing symptoms and focusing on truly improving their quality of life.
Exactly. And sometimes that might involve exploring options beyond medication, like physical therapy if they're dealing with pain, or cognitive behavioral therapy for anxiety.
So it's about taking a holistic view, looking at all aspects of their health and well-being, and remembering that advocating for your loved one, this isn't a one-time thing. It's an ongoing commitment to staying informed and engaged and proactive in their care.
Perfectly said.
Wow, we covered a lot today. We really dug deep into all the complexities of medication management for seniors, the challenges and the potential of deprescribing, and most importantly, the crucial role of patient advocacy. I know it can feel pretty overwhelming at times, but the bottom line is this. Knowledge is power, and we can all make a difference in the lives of our aging loved ones.
Couldn't agree more. It's about starting those conversations, asking the tough questions, and advocating for what's right. And remember, you're not alone on this journey. There are tons of resources out there to support you every step of the way.
That's so important to hear. Thanks so much for sharing your expertise with us today. It's been a pleasure.
My pleasure as well. Always happy to help.
And to everyone listening, thank you so much for joining us on this deep dive. We hope you found this episode informative and empowering. And just remember, you are your loved one's greatest advocate. Stay informed, stay involved, and keep those conversations going. Until next time, stay curious.